This, I believe, will be one of the most transformative occurrences in the history of our nation.
The coronavirus taking hold in the U.S. today, the first containment zone here in New Rochelle, New York, just north of Manhattan.
State officials say about 100 to 200 members of the National Guard will be here in New Rochelle on Thursday to help clean and sanitize schools and public areas and even deliver food wherever it's needed.
It is a dramatic action. This is literally a matter of life and death.
That zone of containment consisting of a 1-mile radius around the Young Israel Synagogue, where dozens of people were exposed. The first in the area to test positive, an attorney named Lawrence Garbus. New York State is now reeling from one of the largest coronavirus outbreaks in the country. New York City's mayor noting a spike in cases.
We have a very rapidly evolving situation on the numbers of cases, and we're obviously concerned when we see more cases, but there's a piece of this that actually is, in its own way, good news, which is the testing capacity is coming online more and more.
Tonight, at least 28 people have died from the virus, including a 69-year-old man in New Jersey, the first death in the Northeast. According to Johns Hopkins University, over 118,000 cases of COVID-19 have been recorded worldwide, with over 800 here in the U.S. As anxiety mounts, medical professionals and potential patients sounding the alarm that there aren't enough testing kits to keep up with the growing numbers.
This is a big problem right now, because really to understand this epidemic, we have to know what the denominator is, okay? And we don't have a full sense of what that is right now.
ABC News has learned that at least 6,600 COVID-19 tests have been administered across the country. Dr. Todd Ellerin at South Shore Health outside Boston says the hospital has been inundated with test requests.
I'm getting flooded with calls from patients and providers that have flu-like illnesses, and many of them are testing negative for the flu and negative for a broad range of other respiratory viruses. So we have to ask ourselves, what's filling in that gap? And I think there's a good chance that COVID-19 is that pathogen.
Quick and accurate testing, he says, more important than ever.
There's no question that at this point, where we think we have community transmission, when you know that there's community transmission, that means there's a lot more undiagnosed cases than diagnosed cases. So we really have to up our level of testing.
In Washington, a state with one of the highest case counts in the country, Seattle Mayor Jenny Durkan says a lack of tests played a major role. In a single Seattle area county, 10 nursing homes and long-term care facilities are reporting coronavirus.
I think as a region and as a state, we do not yet have enough testing capacity. Because we did not have adequate testing, both because of the CDC rules about who could get tested and the very few numbers of test kits we had, we really missed how widely this and quickly this disease was spreading.
Washington Governor Jay Inslee says the state is now bracing for an explosion of cases.
In 7 or 8 weeks, there could be 64,000 people infected in the state of Washington if we don't somehow slow down this epidemic. And the next week it'd be 120,000, and the next week it'd be 250,000.
Today, the director of the CDC testifying before Congress, fielding questions about the delay in getting test kits to health providers around the country.
The CDC's focus was to provide testing for the public health system. There's a whole other system we need testing for, clinical medicine. And I'm happy to say now, with LabCorp and Quest both operational as of yesterday, there's really laboratory testing availability to any doctor's office that can go through LabCorp and Quest. I would have loved the private sector to be fully engaged 8 weeks ago.
The CDC plans to aggregate all testing data collected by LabCorp, Quest Diagnostics, and public health labs with the goal of tracking how many Americans have been tested and what those test results are.
Like CDC, the state and local and territory health departments are underfunded. And I want to rebuild the core capabilities so that we have data and data monitorization. Wouldn't it be nice if we had a data system that every health department in this country right now could see in real time so that we could predict what's going on and where to go and where to put assets? We don't have that.
Most people who get COVID-19 will experience mild symptoms, and many will never have to be tested. But Redfield did reiterate a warning about travel for certain groups of people.
We have recommended that the elderly and vulnerable, including children with chemotherapy and others, should really reconsider at this point travel.
The elderly, comprising a significant chunk of passengers on the Grand Princess cruise ship still docked in Oakland, California. Over 1,000 of its passengers aged 70 or older. With the most serious cases departing the ship yesterday, frustration mounting as just 269 passengers came off today.
We're getting a little discouraged. Once we get off, which will probably be tomorrow, we still have 14 more days.
All 19 of the infected Grand Princess crew members now back on the ship for isolation. And a rare sight, a yellow flag flying, signifying the ship is under quarantine.
It will go away, just stay calm.
Today, the president attended a meeting with Republican senators on Capitol Hill to discuss the virus's economic impact, urging calm. He defended the testing process.
The U.S. has done a very good job on testing. We had to change things that were done, and the testing has gone very well. And when people need a test, they can get a test.
Trump saying he has not been tested, despite spending time with 3 people, including his chief of staff, who are self-quarantining after coming into contact with a man who has tested positive.
I feel extremely good. I feel very good. There's no symptoms, no anything.
But the president also had other things on his mind, tweeting about today's primary election, that it's going to be a bad day for, quote, crazy Bernie. Senator Bernie Sanders and former Vice President Joe Biden competing in 6 contests: Idaho, Mississippi, Missouri, North Dakota, Michigan, and Washington State. There, voters only mail in their ballots. The Secretary of State warning voters not to lick them, but instead use a wet sponge or cloth.
It's really helpful for us to have all vote by mail because people can vote from their home. We've got to make sure that as we're doing what we need to do, we're also keeping our civic society alive and well.
On the campaign trail, the specter of coronavirus loomed large. The Biden campaign offering hand sanitizer to attendees at a Detroit rally. Sanitizer and hand wipes popping up at some polling locations. Tonight, both candidates canceled rallies in Cleveland, heeding public warnings from state officials.
The governor of Ohio asked the presidential campaigns to cancel their indoor public events in Cleveland with large crowds of people. And that's what we did due to the coronavirus.
Biden after a strong night with key wins in several contests, including Michigan.
It looks like we're going to have another good night. With victories in Mississippi, Missouri, Michigan.
Set to deliver remarks on coronavirus tomorrow. And while many are worried coronavirus could escalate to the next level, medical professionals want to assure people that this is not the worst-case scenario.
We have survived pandemics in the past. The last one was 10 years ago. We got through it. We will get through this.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.